Stephanie is so young. I want to watch her grow up, but I don't know if I can. I'm diagnosed with breast cancer. I wish I did something earlier. But can breast cancer be prevented?
Breast cancer can be prevented.
Why is it I have breast cancer? None of my sisters or family members has cancer. How come I am so unfortunate?
Most breast cancer happens by chance. Anyone can get breast cancer. Statistics reveal that breast cancer is growing at an alarming rate, reaching epidemic proportions. In 2010, 1.5 million women were diagnosed with breast cancer. In Singapore, breast cancer is the leading cancer in women. In 2050, it is estimated that 1 in 8 women will develop breast cancer in their lifetime. ECM controls the lifespan of the cell. It is part of the tissue that provides structural support to the cells and performs important functions. Chronic inflammation disrupts and destabilizes proper ECM structure and function in human tissues, such as breast tissues. Hence, the stabilization of the ECM represents a defense against the onset and progression of breast cancer. Matrixcell is the only pharmaceutical-grade biomodifying cream which is able to stabilize the breast extracellular matrix, ECM, and to prevent chronic diseases and provide a deterrent to cancer. Matrixcell's clinical formulation has 5 classes of premium and exclusive natural compounds, unique in their ability to collectively prevent the destabilization of ECM. Absorption is the key to effectiveness in the prevention of breast cancer. Matrixcell's formulation provides optimal phytonutrients release and deposition into the desired skin layer using its proprietary transdermal orthomolecular mechanism. Most importantly, unlike drugs, Matrixcell is extremely safe to use daily. It does not contain paraben, opioids, and steroids. In a study on the effectiveness of Matrixcell in reducing inflammation, it is demonstrated that Matrixcell can reduce inflammation more effectively than drugs by 20% without the side effects. Prolonged use of drugs can lead to cerebral, vascular, cardiovascular, gastrointestinal, and renal complications. The other side effects include hot flashes and virginal discharge, or bleeding or blood clots. It is proven that women with the highest levels of breast density have consistently been found to have a 4- to 6-fold increased risk of breast cancer. And because of dense breast tissues, it is difficult to detect breast cancer with the use of mammogram. It has been known that mammogram is not able to spot anomalies or inflammation at the cellular level of the breast tissues, unlike thermography. Studies have shown that by the time a tumor has grown to a sufficient size to be detectable by physical examination or mammography, it has in fact been growing for about 7 years, achieving more than 25 doublings of the malignant cell colony. In 5 years, there are 1,048,576 cells, an amount that is still undetectable by mammogram. In 8 years, there are almost 4 billion cells. Clinical studies on patients who use Matrixcell has outstanding outcomes, as seen in the thermography studies. Unfortunately, no woman is completely safe from breast cancer. Even when all traditional risk factors, including family history, diet, exercise, and alcohol are combined, more than half of U.S. breast cancer cases remain unexplained. A growing body of scientific evidence suggests that synthetic chemicals and radiation in the environment are linked to breast cancer. Breast cancer survivors may be at increased risk of developing subsequent cancer of the breast, ovary, bone, and uterus because of shared hormonal, genetic, and behavioral risk factors. Matrixcell's biomodifying cream is the perfect therapeutic regime. It is safe and scientifically proven to be effective in stabilizing the breast ECM, which helps immensely in the prevention of breast cancer. Matrixcell, perfect peace of mind.